Is the CDC recommending Americans wear masks in public? Let's bring in CNBC contributor Dr. Scott Gottlieb right now. He is the former FDA commissioner. Doctor, it's good to have you with us again. Your reaction to what the CDC is now recommending?
Good policy. There's more data that came out today. I put it up on my Twitter account about how masks can prompt a reduction in transmission of flu and presumably coronavirus. And so this should be incrementally helpful in areas especially that are hard hit by the coronavirus, where you have a lot of mildly symptomatic or asymptomatic people who are going out and potentially spreading the virus. This will cut down on their risk of transmitting the virus to others. That's going to be the biggest effect of this policy.
We've talked nightly, Dr. Gottlieb, about governors who are issuing stay-at-home orders and those who are not. Tonight, the Missouri governor has issued one. Still, others are not. The president asked about it tonight, says he is leaving it up to them.
Well, the federal policy amounts to a stay-at-home order, if you will, if the governors would follow it. In our federalist system, it really does fall into the hands of the governors and local officials to implement those recommendations. And some governors haven't. As you said, if you look at data in the heartland and the Midwest, you see much more travel by consumers. Consumers are not staying at home. They're going out. They're not social distancing. And those states had the ability to get a head start on this insofar as they saw what was happening in other parts of the country, and if they implemented more vigorous steps, they had more of an opportunity to prevent large outbreaks in their cities. Now, hopefully they will dodge it here. Hopefully they won't have a lot of spread in those parts of the country. But germ theory being what it is, this virus wants to go everywhere. And so I fear that no state is going to be completely spared by this. You're seeing in the models tonight some slowing in new cases in the Northeast and New England, particularly New York. New York's going to have another tough week, and hospitalizations and deaths, unfortunately, are going to lag new cases. But new cases may start to slow next week, and you may see New York start to hit a peak. The attention is going to start to shift to the Southeast and the Sun Belt, where you're going to see cases start to grow very quickly. Louisiana looks very bad tonight, and Texas, Georgia, Florida all have to be areas of concern right now.
That's exactly what you tweeted earlier. In fact, you say some of the models, including the one that the White House watches, are showing some signs of slowing, including this area and up in New England, as you say. Still very worrisome, though. Detroit, Los Angeles, New Orleans, Miami, Georgia, Texas, they need to be watching things very closely in the coming days. What will you be watching for, Dr. Gottlieb, over the weekend?
Well, I think you continue to look at the new cases and see what the time that it takes for the states to double the number of cases. Right now, Louisiana is doubling every 3 days. Florida is doubling every 4 in terms of the total cases in those states. The other thing to look at is the testing and the positivity rate. A lot of states still aren't testing a lot. Texas is testing 0.19% of their population. Georgia's about 0.17%. That compares to New York, which leads the nation at about 1.25% of tests. They're testing their population at a rate of 1.25%. So you look at the rates by which states are testing their populations, and if you see states not testing a lot of the people within their state, but nonetheless having a high positivity rate and mounting cases, that's a bad combination. That means that there's probably a lot of undiagnosed infections, and that, in fact, is what it looks like right now in states like Louisiana and Florida. Certainly, Los Angeles and Detroit also look concerning, but those were cities that implemented mitigation steps earlier. And so you hope that over the next week or two, you're going to start to see the benefits of the steps that they took to try to slow the spread.
Dr. Gottlieb, how should the federal government be handling its stockpile of ventilators? And I'm wondering what you would be recommending if you were still in the seat at the FDA. The president tonight saying we happen to think he's well served with ventilators. Speaking of the New York governor who says they need ventilators, the president holding them back for when he needs them, he says. Is that a good strategy?
Well, I mentioned that New York is going to show signs of potentially peaking in their epidemic, perhaps as early as this week or maybe into next week. But there's no model that shows New York not exhausting their healthcare resources. Every model, even the conservative one, shows New York exhausting the number of ICU beds that they have available and exhausting the number of ventilators that they have available. New York is going to be very hard hit, and there's a lot of morbidity. If you look at what's happening in New York now, and we don't fully understand why, the morbidity in terms of people who are requiring ICU admissions and people who are succumbing to the virus is actually ahead of where Italy was at a commensurate stage in their epidemic. And that might be because we have more people who are high risk in New York, more of an elderly population, more people with comorbid illness. So New York's healthcare system is going to be overwhelmed by any scenario. The feds don't have a lot left. The feds have been largely tapped out. They're holding on to a small number of ventilators relative to their total stockpile. They've depleted more than half their stockpile. They probably are recognizing that they're going to need to pour resources also into New Orleans and Florida and potentially other states in the Southeast and the Sun Belt as the epidemic shifts to other parts of the country. So I suspect that they want to hold on to some of those resources. I would be counseling moving what you can and what you have into New York right now. You can always shift those resources out of New York later if you have to. But right now, you need to backstop the city that's having the biggest public health tragedy, and that's New York right now. New York is dangerously close to depleting their healthcare resources going into this week.
To be clear, you would be telling the president tonight to give New York more ventilators.
Well, I have been saying that. I think we should put the resources where they're needed at the moment with the hope that you can shift them around later as those parts of the country start to recover. I don't think that we should be holding back resources if cities are coming up against their limit in terms of what they have available to treat patients. Now, that said, New York still has capacity left. They're converting about 3,000 BiPAP machines into ventilators. These are breathing machines, assisted breathing devices that can be converted into ventilators under a protocol that they just approved. And they still have about 1,000 ventilators in their own stockpile that they're going to be forward deploying, and another 300 that are moving from upstate into the city. But that's not a lot. They're burning ventilators at a rate of around 300 a day. So after about another week, they're going to deplete what they have available. So going into the end of this week and into the following week, they'll be maxed out. Time on ventilator is long. Patients are staying on the ventilators for 10 days, sometimes more, depending on what hospital you talk to. And the mortality rate, once people get intubated, is very high. Now, the CDC has not published statistics on this yet, and they ought to be publishing that soon on what the collected clinical experience is in the United States. But when I talk to hospital leaders about their experience inside individual hospitals, both in New York and other parts of the country, they're saying that 70 to 80% of people who get intubated with COVID-19 ultimately succumb to the infection. That's very high.